you are here with some jerky movements. Can you tell me a bit more about it?
Doctor, yeah, I was in the TV hall
Mm-hmm.
with my wife. She said something went wrong with me. I was not myself, and then she noticed that my eyes were rolling up, and I was fitting.
Mm-hmm.
Yeah.
Okay, Michael. This must have been really worrisome for your wife to see you in such a condition.
Oh yeah, doctor. Yeah, I don't know what happens. I was quite confused even when I came to hospital by ambulance.
Mm-hmm. Okay. And when you were having this kind of activity, so what did she do?
She called ambulance, and I think probably the ambulance came in next 10 minutes. And they at that time, by the time when the ambulance arrived, I was okay, and but I was a bit confused. And after that, they brought me to the hospital. Now I'm with you.
Mhm. Okay. Michael, I'm just going to ask you a few questions. They must be very stressful for you because you have to go through a bit through the situation you went earlier. Would that be okay with you?
Yeah. No problem. No problem.
Okay. So, Michael, when you were having this this jerky movement, so can you tell me that did you soil yourself?
No, doctor. I didn't soil myself, but I
Mhm.
wet myself.
Okay, all right. And did you felt unconscious while you were having the fit?
Yeah, doctor. Totally. I don't remember anything. I don't remember anything.
Okay, and did you vomit?
Um, I feel sick, but I didn't vomit it.
Mhm. Any funny sensation or any different kind of taste in your mouth at the time?
No.
All right. Did you bite your tongue?
No, I don't.
All right. Okay. So when you were having these movements, did your body get stiff?
Quite. Yes, that was. I don't remember actually, but my wife mentioned that I was very stiff. My body was very stiff.
All right. Okay. So, Michael, you say that you don't remember what happened really, but after that, did your wife notice any kind of weakness or any bleeding from any part of your eyes or ears, nose?
No.
All right. Okay. That's fine. And before everything happened, did you see any kind of flashes or lights before the fit activity happened?
No, not particularly. I couldn't.
Mm-hmm. And Michael, is there anything in particular you are worried about today?
Yes, I want to know why it happens. Never happened. I don't know. I just want to know.
Okay, all right. Okay, Michael, I'm here for you and I'm totally going to run a few tests and I'm going to examine you completely. So please bear with me. I'm just
Okay.
going to run a few yes or no questions to get to the heck of everything. Would that be okay with you?
Yeah, it's totally fine.
Okay. Michael, so after this activity, before or after, did you run any kind of temperature?
Uh, maybe fever or flu previously, but not particularly temperature.
Okay, all right. And the flu, how long?
Uh, week, but it was not that.
Okay. Did you do anything for it?
Um, no, just
Right, okay. And, other than this, did you had any headache?
no. I'm okay.
Okay. Any problem after it?
No.
Any rash? All right. So Michael, after this, I just want to ask a few questions. Would that be fine?
Okay.
Okay. Michael, by chance, do you take any kind of recreational drugs?
Um, I no, I don't do anything.
Mhm. And go right. Uh, any medical conditions? Any by chance any family of epilepsy?
No.
Right. Michael, interested in hobbies like some in swimming, kind, skating,
I do like 2 minutes
right?
left.
So, information you have given me, and I would like to examine. I will be checking your organs. I will be having a look at your knee. I will your nervous system. I will be okay with you.
Okay.
Thank you so much for being so cooperative. Michael, do you have idea why all this is happening with?
No, doctor, I just know.
Okay. Michael, according to what I have assessed in you, and I feel that after this discussion, you told me that you had this and your activity was a bit of movement and stiffness. So I'm suspecting that you have had seizure, and the most common cause we see that due to fit or seizure is due to epilepsy. Do you have any idea about it?
No, doctor. What is that, doctor? Is I'm having epilepsy?
Michael, for that, we are just going to run some tests, some investigations, like some routine checks, some blood counts. We are going to check the function of your liver, kidneys. We are going to check some salts level, your blood sugar. And after that, we are just going to do some other scans. And for that, I'm going to refer you to the neurologist as well.
Okay, what he would do?
Well, the neurologist is going to see you. He is going to reassess and re-examine you, and he's then going to further go for some neurological scans. Would you like to go for them?
Oh yeah, I would do. No problem.
Okay, Michael. And if epilepsy is confirmed after that point, then we are going to start you on some medication.
Thank you, Ramesh.
Welcome.
So we got Dr. Mariam here as well. I hope she's listening as well. We got Dr. Mariam, we got Dr. Zubda. So what do you say about this consultation? So
Hello, good afternoon. Well, I just came in between of the consultation.
okay, whatever you heard, just give some of the debriefing of that.
Yeah, so
Zeeshan, I want you to open your camera as well and just debrief few of the things about consultation, what you have learned and find positive
yeah,
things.
so the good thing was that the doctor was offering the patient in time in terms of the management part. Like, would you consider doing that? So that was a really good thing, the involvement of the patient, even though the time was up, but then she was cool and calm, and she was, it made like a good in a kind of a way that she was confident what she was telling, right? And then and that was really good and a key learning point for all of us, that she involved the patient in the management. Yeah, thank you.
Yes, definitely there is always a room of improvement. So you have seen my consultation. So guys, I would like to tell you, even anybody is going to tell you that go for PLAB to do 8-minute consultation is not. Doing 2-hour speech is easy, and doing 8-minute consultation is always tough. So every time, and want to tell you, to pass your PLAB 2, you don't need to get 12 out of 12 in every station. You can have it in 1 or 2 stations, or 4, 5, 6, 7, 8, 9, 10, 11 stations, or 12 stations as well. Or even 16 stations, you can get 12 out of 12. Yes, you can pass 12 stations. Do you need to pass all station on 12? No. Always be kind to yourself. So the whole idea of doing these simulation is that to tell you, to show you that who have passed their exam, who are working in NHS, the simulations sound like eight score simulation, 6 score. The passing score sometimes goes down to 5 as well, 6 as well, 7 as well, 8 as well, 9, 10, 11, 12. So these are the things will be borderline regression that the people who are performing with you. So definitely, what would you say about this consultation, Hasham? What you learned from this consultation?
It was really good. I think ma'am has covered every area, but you have to be specific. I mean, 8 minutes, they are just a few minutes for a complete exam. I mean, for a complete to discuss every DD, every red flag. I think it will be too much. You have to be
Yeah,
specific.
I will answer that. I will answer that anyway. And first, I will discuss the approach, and I'll try to this scenario again with Ramesh. Okay. I'll discuss the approach and I'll tell you where you could have saved the time. Then I'll try myself that will I be able to save some time in 8 minutes? And will I be able to reach the management before 2 minutes? So we will all agree on that. So I'm going to share screen now and I will score Ramesh according to our consultation. And I want you to do the positives. So first of all, the positives. I'm going to tell the positives as a whole consultation. If the consultation give a positive impact as a whole, that you don't, first of all, you don't seems like a medical student. You should seem like a doctor. Yes, Ramesh seems like a doctor, polite doctor, tone was okay. Was the consultation was 100% okay structure wise? Is the need of improvement? Yes, there is a need of improvement. What need of improvement? Time management. So for me, she put too much time in data gathering. She might get 4 in that, but the management, when she reached to the management part, that time she might have to speak a lot of things. And the missing part was that we don't get interactive. So if the simulator don't get interactive, yes, is listening, okay, that this doctor is just telling me don't want to get me involved. So at that point, little bit of improvement needed. Why? Because she done data gathering very well. She just missed family history in there. But few of the things, how you would do the data gathering in less time is a skill. It comes with asking very impactful one or two word and just noting with that. So let's share the screen now and we will discuss, and the Ramesh, you will debrief yourself what was. So I'm sharing that sketch. Then I want Ramesh to speak where the mistakes happened from your consultation, because we ourselves know that what are the mistakes we have done. So I'm going to share the screen now and I'm going to share that sketch as well. Share. And now you will be able to see my screen. And I got the sketch for the first seer. So Ramesh, let's quickly. Okay, so you can see that screen now. I will come to one by one every point and you will see where the things could have improved. So let's come to the point. So how the Ramesh started and how you guys would be doing it. History of presenting complaint. She said me jerky movement. First of all, she said, okay, I'm here to help. I understand from your notes, you got jerky movement, you got fitting. Tell me more about the open-ended questions. She started with that. So then the next part was before, during, after. She would have asked two to three questions, not more than that. So if I was Ramesh, I would have asked, okay, Michael, can you please tell me what you was doing at that time? Anything specific happened? Two questions, that's it, during, before that. That is the before. And during, do you remember everything during? No, doctor, I don't remember. By any chance you wet yourself or spoiled yourself? Any tongue bite during that? No. Okay. After the incident, was any tongue bite? Was any tongue bite? Do that episode was witnessed by your wife? Yes. Okay. Did your wife told you that you are confused? Is this happened first time? By any chance anyone recorded video of that? Who witnessed that? Do you remember everything? You can ask. By any chance you banged your head? By any chance you remember you lost your fainted? So Ramesh can ask straight away, did you fainted? Then do you know hardly how long? Okay, so it's a very common thing. So you can ask those things. So Ramesh, you tell me what point here you think could have improved in the history part?
I didn't ask about the head injury.
Yes.
Any video thing? I didn't ask that your wife make any video of you.
Okay. And did
I
it happen
asked,
first time? Did
what
you
did
ask about?
your wife do?
Did you ask about that? Did it happen first time?
Yes, maybe I asked this.
Yes, maybe you have asked. I don't remember.
Yes, I asked it.
Okay. DDs. The first red flag you would be asked. She did ask about arm weakness. You could have asked about slurry speech, because I have to rule out fits when you are in any setting. It's a hard situation, guys. I'm telling you. If somebody is coming with a stroke, and I'm not going to call stroke regs, and I don't document the name, trust me, heartbeat will, because this is a dangerous situation. You need to rule out stroke first. Because if fast is negative in the A&E setting, if fast is positive, I won't be a good clinician if I don't speak to the stroke reg. I have to make sure weakness, slurry speech, any weakness of arms or legs, okay? Any fall or bang your head, ongoing stress, we can ask, but not here. Fever, problem with the light, neck pain, meningitis, any rash, do you feel sick? Early morning vomiting mean that by any chance do you have any trauma, tumor? These are the few DDs you can ask. I ruled out stroke, that's fine, you done it. Problem with the walking balance. Why I'm talking about the balance and walking, Ramesh? Because I want to rule out posterior stroke as well. Yes. Along with the fits, because there are two things which I'm ruling out: the fits, infections, fits, infection, stroke. That's it. Fits, infection, stroke, infection, meningitis, fits. Yes, I have to rule out. Why? First, I have to rule out stroke. If it's not stroke, I'm not worried now, because first 50% of people might have, but I'm not doing as an A&E physician. I'm not going to do anything now. That can be done in the first fit clinic. But now, if it's a stroke, I have to do something. Ramesh, you happy with that? So these are the things which we can improve on. Moving to the next part. Yes, so if the fit don't need to be for the para. Zubda, that's a good question, but the thing is your history will be flexible. If something happens like bang, fit, dizzy, always start with the incident history. We added incident history. So you will ask or the para flexibly, but not here is incident history.
general background, that is thinking about your general health, signposting, non-allergies. You can ask about blood thinners because somebody fitting might have band head, or you can ask family history of not migraine here. You can get the family history of high blood pressure or family history of what we call it, stroke. Oh, sorry, epilepsy. Here you need to ask epilepsy. I will update it. Epilepsy. Okay. What do you do for living? Is this important to ask? You asked about my job, Ramesh.
No.
Yes, might be I'm working on the fifth floor, sixth floor, seventh, eighth floor. So I told that you need to ask about job to be a safe doctor, especially in the fits, because someone working with machinery, working on fifth floor, sixth floor might have risk of falling. Okay. Now coming to signposting, diet, excess smoking is important related to the stroke as well. Alcohol is, you can ask. This is not important. Not important at all. Epilepsy, asking epilepsy is important. Idea, Ramesh done well about asking idea concern, but still it can be improved. Anyway, now coming to the examination, should we do ECG? Will you do ECG in the A&E setting? In the A&E
Yes.
setting, we will see the ECG. Will we do CT head?
Not
In
at the
this-
moment.
Sorry?
Not at the moment. We are
will do-
going to refer the
We
patient
will
to.
do the CT head. We will mention that.
All right.
Okay, I'll show you the guidelines from my A&E hospital, and in every case where I'm suspecting, like he given you a lot of findings of it. You have to do the CT, you have to do the full seizure profile, which would include everything, electrolyte, calcium, magnesium, everything you'll do. You'll tell that in management part. Yes, you will do the ECG, you will do the CT. Why you'll do the ECG? You might have some finding in ECG. Okay. And anyone know why we do the ECG? Because even someone's young one is coming with the funny turn, faint they might have some finding on the ECG. So how would you explain first figure? It's a jerky movement of the body, often caused in never found in 50% of people. Sometimes we don't find the cause of the move. 50% of people never have another episode as well. But further investigation is required. Don't worry at the moment you are at the safe place. What I would do now, how to explain now. You will say that I'm going to refer you to the first fit clinic. You will mention that in UK there is first fit clinic. I'm going to refer you to the first fit clinic. I will write them letter now. They will get back to you in 1 week time or maybe 2 week times. They will going to see you, and they will might do other special tests, or if the suspicion is not very high. If suspicion is not very high, you might not do the CT scan. But if the suspicion is very high, like in this scenario, you will do the CT scan because the patient come up with proper neurological symptoms, what he has told you. So you might do CT scan in the A&E setting. But if you are not doing CT scan in the A&E setting, you will say they might think of doing further investigations. Neurologist will see you and reassess your first seizure 2 weeks. Will reassess your first seizure at least in 2 weeks. You will get a letter in 1 week time, and they will see you in 2 weeks. Neurologist will see you and reassess your first seizure clinic. You may have further investigations, and if epilepsy is suspected, treatment option will be discussed with you. But you will tell them hope that 50% of people don't have any second fit at all. Advice: first seizure leaflet until being seen by clinic. Please, Ramesh, you didn't tell me that. Please inform DVLA. I told you that being an IMG doctor, we always forget about that. Because if you don't do that, you might lose 1 or 2 score in management. Might be they put 3 score for DVLA. Might be 2 score for DVLA. Because it's a safety netting advice. Patient go outside, your doctor didn't tell you not to drive, he had another fit, he bumped into the school bus. What would happen? You getting my point? Why DVLA is very important. So DVLA is important, and not to drive until they have given you permission to do so. This may depend on advice from specialists. So first aid, inform family and friends, relative to keep you if happen again. Safe place, put you in the safe place, call for help. If it's greater than 5 minutes, try to make a video of it. Always keep you calm, remove from dangerous objects around you. Safety net, follow up. So follow up would be that don't drive, don't take bath, take shower, not go to hiking. I told you I love swimming and everything. Yeah. So that's fine. So Ramesh, are you still here?
Yes, I'm here.
Okay, let's do it one more time. And this time you will debrief me. We got the sketch, and according to this, guys, you are going to score me on the basis of the. So I've given you score criteria now. Okay, you need to score me, and if it goes well, and what I would do, if it goes well, what I would do. Okay, sorry. But overall, your consultation was very good, Ramesh. But always there is some like these things I learned when I went to the A&E. When I was doing consultation about the first, I had a lot of questions about first fit. But these are the things which I got to know when I was in the setting, how it goes and everything, what is most important. And I went through this pressure situation, kept asking my consultant, and I got to know that first fit, how we do that. So there's always a room of anyway. This is your time. You will do it critically. My consultation now, and after that there's another one. We'll do it, and let's do it. So you technically let me score Ramesh now. IPS while I'll give 3. Data gathering, she skipped 2 things, so I won't go very hard on her. 3, 3, 3. DVLA he missed on. So management, I didn't like management. So 3, 3, 6, 8. 8. So I want to show that how I'm scoring on. You agree with that? Why I've given you 2 in management, because you missed DVLA, you was rushing, you get less time, so you could not able to manage time. So your history taking was too long, and well done, Ramesh. So you passed this scenario again, even passing your PLAB too. So we'll do it now. We'll do it together. So remove pin. So well done. So my name is Michael Brown. Sorry, your name is what is your name? Lita Brown. Okay, and you having the same story. I'll try to do it. Let me get the timer on. And who is going to debrief and score me? Dr. Mariam, Dr. Zubda, Dr. Yumon, Dr. Hasham. You have to score me, and literally you have to write down the score, whatever you're scoring. Dr. Noor as well. So I want you guys to score me and tell me what mistakes I've done, because when you are performing it in 8 minutes time, definitely you will make mistakes. So just give me 1 second. Okay, so let's start now. Hello.
Hello.
Hello, I'm Dr. Gafar, one of the doctor here in A&E. Is this
Hi,
Lita
doc-
around?
Yes, doctor. It's Lita.
Hello, Lita. I'm here to help you. I understand from my notes that you came to hospital with an ambulance. Is that okay? Is everything
Yes,
okay with you?
yes, doctor. I had a fit doctor at home, and I'm very worried about it, doctor.
I'm sorry to hear, but just quickly, I need to know your date of birth. Can you please tell me?
Doctor, it's 20 February
Thank you very much
1984.
for that information. Okay, thank you very much for that. You just mentioned that you had a fit at home. Can you please tell me briefly what happened, the whole story incident?
Well, doctor, I was watching TV with my wife, and
Mhm.
suddenly I had this a brief episode, which you can call as a fit, that I suddenly stopped and I couldn't move. My eyes rolled upwards,
Mhm.
and
Mhm.
my wife was very surprised to see what happened to me. And
Mhm.
it was just a minute of activity, and after
Mhm.
that, I don't know what happened,
Mhm.
because after 5 minutes, I don't remember
Oh.
what
Mhm.
went wrong.
Oh, it must be quite stressing for you and your family anyway.
Yeah, because we have never seen something like this happen.
Definitely, I will help you with that. Let me ask, is that happened first time? Is that happened
Yes,
before?
yes, doctor. It was the first time.
Okay. So before that, you said you was watching TV. Have you noticed anything specific happened before that? Have you
Like
seen
what, doctor? What
nothing?
specific?
Okay. And during the incident, you remember everything what happened?
Doctor, I just remember watching the TV and nothing else.
Oh, no
Everything
worries.
I know is from my wife.
Oh, okay. So your wife told everything. Anybody else notice it, or
Oh,
anyone
no.
take video of it?
Oh, no, doctor.
Okay, no problem. Okay, during the incident, by any chance, you bit your tongue? Or
Nothing like this, doctor.
okay, by any chance, you wet yourself or soiled yourself?
Yes, doctor. I wet myself and I was
Mhm.
having this fit. My
Oh,
wife told me, because my clothes were all wet
all right.
afterwards.
It's okay, no problem. So we'll find out. After that incident, do you remember like you was confused?
Yes, doctor. I was confused. I didn't remember what happened.
And how long actually it been now from that incident total?
Doctor, like 2 hours.
2 hours, okay. Okay, a few more questions about. I will just try to go from a very serious to less serious conditions. Okay. So, by any chance, do you feel like you're having spiking any temps in your body? Temperatures?
No.
No temperature. Any problem with the light?
No.
No problem. Any pain in your neck?
Nothing.
Okay. Any weakness of your arms or legs?
Felt a bit weak after the fit, but I don't
That-
normal
that's
or
quite
not.
natural. But you're able to lift your arms and you can.
Yes, I can.
Good to know that. Quite assuring. And anybody told you that you have any facial droop or like weakness on your face?
No, nothing like this.
Okay, okay, no problem. And thank you very much. No slurry speech as well?
No.
No slurry speech. Okay. So recently, any fever or flu in past 2 weeks?
I'm having this flu since 1 week.
Okay, okay, okay. All right. So, while thinking about your general health, are you on any medications like blood thinners?
No, doctor.
By any chance, you banged your head? Have they told you that you banged your head?
No.
Okay. Any non-allergies?
No.
Okay. What do you do for a living?
Well, I work as a constructor, so I work in buildings, and this is my work.
Okay, okay, no, okay, that's good. You work at the construction industry. Good to know. Well, thinking about that, so it recently happened to you. Have you given a thought what could be the cause?
Doctor, as I told you, this is the first time we have seen something like this happening near us. So
That makes sense. That makes sense. I'll come back to that. Any particular concern in your head at the moment?
No, maybe I had some problem with my brain or something.
Oh, okay, okay. Definitely, I will reflect back on that after finishing my assessment. So at this point, I would like to examine you, okay? And for that, I have to check the nerves of your face, your hands, your arms, and your legs. And I have to see your front and back of your eye. I'll check your vision, and I'll have to have a feel of your neck. I have to do some special test for that. And I might need, because you have got some positive finding, I might need to request a CT scan as well to make sure everything is okay. And is that be okay with you?
Okay, doctor.
Okay. Miss Lita, basically, after having a chat with you and after examining you, the symptoms which you told me seemed like you had a fit, we normally call first seizure. Have you ever heard of that?
Yes, I've heard of it, but not more than that. So can you tell me a bit more about it?
Yeah, definitely. It's a part of jerky movement. So it's a seizure. The 50% of people can have this one in around UK. But the good thing is that out of those 50%, 50% people don't get it again. But we need to rule out epilepsy as well. So epilepsy is a condition in which the people have multiple seizure. Okay, but we'll make sure that we'll provide you everything what you need. At the moment, I need to refer you to the first fit clinic where they will do special blood test. Okay, am I making sense to you?
Yes, doctor. What
Okay.
blood test?
They would do all other sorts of your electrolytes, we call it salts, and some special tests, and they would reassess you again, neurologist, and will see that and will tell you other things. For now, I would like to tell you, you need to not to worry much about that, but I would like to advise you not to drive going back home if you are not driving. It's
Okay, I have.
because until you're being told by the specialist not to drive, okay? Okay, Lita, one more thing. Thank you very much. One more thing, Lita, I would like to tell you, you need to keep an diary. And you mentioned that you work in the construction industry. Try to avoid going to the upper floors, okay? Because I'm a bit worried about that. It can cause you so that you would have a fit another time and may cause you some trouble for you. And one more safety netting advice I would like to give you. You tell your family, your wife, few of the things. We can give you a leaflet in which tell you the video, how to make a video with somebody getting fit. Okay, finish, time finished. I wanted to tell more, but I wanted to be calm down as well. Yes, guys. Rami, you give me score now.
So you did the history part right, and maybe you could have included headaches.
Headaches. Yes, okay. I didn't. Yeah.
And you didn't ask anything from the DESA part.
I skipped it myself because I skipped it myself because I was running out of time. I know that.
You cannot cover everything. That's
Yes,
fine.
I skipped myself this part. I said because there is something very important to cover. So I don't want to do that. Because if I would have asked DESA, diet, alcohol, everything that was at that point, I said, leave it. Because I would This is what I try to be on the point, because I knew that in first year I have to tell loads of things too. Yeah.
You missed the examination.
I did mention examination. I will have a look of your nerves of face, your arms, and everything. I did mention. I
Okay,
didn't
I would have.
mention.
And the provisional diagnosis was good. I liked it, the fit and the seizure, and then maybe it can be epilepsy. And it was good. Everything was fine.
No, but I feel like I should have 1 more minute in management part. So,
It
but
never
now I
was.
understand. Now I understand, Ramesh, where you were struggling. It's not an easy station, definitely.
This
The
is never
epilepsy first
stage.
period.
Never I to practice it as well, so I would have never covered it in time. So I'm okay with it. This is
Yeah,
quite
yeah, because I was thinking to tell you more that you need to trigger diary or something like that. Don't do this, this, this. But anyway, it's not an easy station. It's not an easy station. But I would like now, Saban is here, and Dr. Noor, you just tell what things I missed and which part you think was done better. Then after that, Mariam would be. Is that okay, Ramesh? If you, because I know there's one more scenario to do. Mariam will do one scenario, then after that, we'll do that one. Is that okay with you? And I want you to debrief that scenario, what the Mariam would be doing. Okay.
okay. It's
Mariam,
fine.
is she's here or she's gone?